नमस्कार, आप सभी का स्वागत है। मैं हूं राहुल और आप देख रहे हैं पीएम eVidya चैनल्स और एनसीईआरटी का ऑफिशियल यूट्यूब चैनल। Today we have a very special program because we are bringing you the MANODARPAN Paricharcha, and today we have a topic of discussion which is synergistic role of family, school and society in well-being of students and young people. So this is the topic of discussion in today's Paricharcha, and we have a very good panel, to discuss on this important topic. This is the Manodarpan, which is very important and very informative initiative. You can say एक बहुत अच्छी शुरुआत है शिक्षा मंत्रालय के द्वारा, जो हमने काफी समय पहले शुरू किया था. So I would like to inform you the national helpline of the same, which is 844-844-0632. So we would like to start this wonderful session with our experts. I would like to invite Professor Subhash Chandra Roy from our Northeast Regional Institute of Education, Shillong. Sir, namaskar and a very warm welcome in the session.
Thank you, Rahul ji. Good afternoon to all my esteemed panelists today. As you know that we are here to discuss on a topic which is very, very relevant as on today. What I believe is that, today the society is suffering from the degradation of values, the cultural values, ethics, the constitutional values, what I find. And I also find that it is because of, the social values, the social relationship, etc., they have gone down to a great extent in the society. Not only that, our students are not learning what are required in this 21st century. And because the whole mandate of education is to develop the holistic personality in a humanistic way, to develop the 21st century skills these days, what we call it as, and the three domains, the cognitive, affective, and psychomotor domains, as well as the emotional skills, the social skills, and all the 21st century skills, which are very much required to survive in this world. And because we are aspiring that this India has to lead the world in the coming days. And what we find that our students are even uprooted from the culture. They lack the patriotism to a great extent, and they have no connection. They have no connection with family and society and all. So why this? And I believe that today's topic is very pertinent in the sense because this goal achievement process is not the only one role of the particular agent like a school. There are many other players. So the society is one, school is one, family is one, and all these three players, they together, when they synergize well, they together can achieve these intended goals in education. So with this background and backdrop in mind, I would like to go to my first panelist, Dr. Maithili Hazarika. Maithili Hazarika is an associate professor of clinical psychology working at Medical College and Hospital Guwahati, and she is specialized in the psychological aspects and psychological problems. Ma'am, would you like to throw light on the role of family in the development of the child, or how the family matters a lot in the development of the child, because we have to achieve the intended goals which are already determined to a great extent, and the family is one component which plays it seems that it plays a great role. So I would like to hear from you, how do you visualize the role of family in the life of this a child or the child's development, because people see that the upbringing is the future of the child. Upbringing, how the child is brought up, it determines the future of any individual. Please, Dr. Mackley, just throw some light on this.
Thank you, Professor Roy, and all the other panelists, esteemed panelists present here. Thanks for this invitation to be one of the panelists here for a very interesting session. The focus on family, we all know it's the basic primary unit of any society. So when we talk about family, we need to also know that family is an evolving concept. At this point of time, you know, the family roles are changing because the family itself is something which is evolving. So I am going to a slide where I had written down certain very important concept about the evolving mechanism. We have seen over the years that from the joint family session, you know, we have come to extended, nuclear, now transgenders families are there, single run families are there. So in order to keep it very simple for today, what I mean by family is an intimate domestic group of people related to one another by bonds of blood, sexual meeting, or legal ties. So when we talk about the most basic social unit, we also need to understand that it is very critical to any student's growth. And research also have shown that when the families are engaged in a child's life, like school becomes a highest priority for that particular student, because the student loves to go to school because the family members knows about the child and what he's doing in the school, how he's interacting with the classmates, what about his attitude towards the other members in the school. So a family needs to be engaged in the child's life in school as well as in other domains. And it always incurs a gain in a child's life because the social skills develop if the family is involved. The mental well-being of the child also improves if the family is involved. So now the most dramatic changes that have been seen in the following areas are in the divorce rate, the single parent household, and the dual earning families. Now we have seen in the last 50 years that the intensity of problems have escalated to the extent that we also need to evolve, and the parenting skills and family rituals have also evolved in different ways, because the kind of single parent households now that we see is increasing due to many reasons. And there's a dual earner families, like both the parents are working, so the quality time spent with the children are also less. So what is happening is that the changes that we see in the family definitely has an impact on the child's growth, mental, social, well-being, as well as the intelligence. So now what we see is that fewer than 15% of today's teens or children live with both biological parents in a household where the father is the only breadwinner. That is definitely decreasing. And family income also, dual partnership, number of siblings are decreasing. There's only one child. Stay-at-home mothers are decreasing. So because of this, there are diverse causes for different kind of problems that are happening in today's world. So now what we need to focus, what we understand as psychologists is, before in 1800, family was the primary caretaker in every aspect, in education, say religion, medical, economic, everywhere. But now the only thing the family needs to be concerned about giving the affection and the love to the individual, because all other institutes like the educational domain is taken care by the school, the religious domain is taken care by the different religious authorities, medical is by the medical professions. But now the only thing that maybe we are left behind is affect and our affection towards our children. So the family in our time has mainly emotional or affective functions to provide love, nurturance, and affection above all else. That needs to be understood by every one of us. So the families form a system of interacting elements. We always see that the parents and children influence one another, parents influence their children, both directly and indirectly, and also the children influence their parents in some ways. But again, they're the influence of the television, the books, the social media. It is an amalgamation of different sources of information and sources of support that a child grows up in today's world. So before, the functions of the families were only for the survival of the offsprings, how to take care of the physical needs of the child, the health need, the safety, the economic function, as well as the cultural values. And parents becomes direct instructors. Parents may directly teach their children some skills, rules, and strategies, or they might be indirect socializers because the parents are modeling their behavior and the children are learning from the parents. So whatever the parents are doing, how they are behaving matters a lot in the interpersonal domain. And then the parents are also providers and controllers of opportunities. They give the child very good experiences as well as adverse childhood experiences that are negative experiences in life. So that has a very negative impact on the child's mind, and that is seen when they grow up in adult life as well as in their occupational skills. They may fail, they may not be able to live up to the expectations, they may have failures in relationships as well as in other domains in life if the parental dimension is not well preserved with the child. There are two general dimensions of parental behavior. The first is the degree of warmth and responsiveness that parents show their children, and the amount of control the parents exert over their children. When I talk about love, warmth, and responsiveness, we all have to understand that there are two extreme points. One end of the spectrum is parents are openly warm and affectionate, and other end of the spectrum are parents are relatively uninvolved with their children and sometimes even hostile towards them. So both of them in some ways are not very conducive for a child's mental growth. So the parental control, what we think about the effective control that we have, what I understand as a psychologist, what we propose to our parents when we do counseling is that we always ask our parents to set some standards that are appropriate for the child's age, because it has to be age-centric or age-specific. And showing the child how to meet the standards also. We need also to make the child understand how to meet those standards, reward the child for complying to those standards. And parents should also enforce the standards consistently. It cannot be once, it has to be consistent and regular. And also effective control is based on good communication. So when we talk about the parenting style, if we can understand this slide, I think we can understand a lot of our parenting styles. There are 4 types of parenting styles which has a deep impact on the child's growth. One is authoritarian, authoritative, indifferent, and indulgent. When we talk about authoritarian parenting, it is like do it my way because I said so. It is like a Hitlerian kind of a controlling mechanism. Authoritative parenting, no, you can't go to the mall today. You know the family made plans to go to see your sick aunt. But how about, dropping you off at your friend's house on the way back home? So it's a good enough compromise kind of a thing. The child is, mind is also kind of satisfied, and the parents also, the demand of the parents are also kind of ascertained. So this is the best style of parenting as far as research shows. Another is indifferent, like, mom, are you home? And I guess I'm in charge of dinner again. So she doesn't even know who is in charge of dinner, what she's going to do for the child. Another is indulgent. Anybody can do anything, in their home. There's no rules and regulations. So when we talk about child's mental growth and physical health, parents definitely have a deep impact, and the authoritative parent makes children responsible, self-reliant, and friendly vis-a-vis other, parenting styles. But when we talk about, again, there's a concept of attachment here. Attachment is one phenomenon which I want to highlight from the family perspective, is that there are different types of attachment styles between the parents and the children. So when we talk about attachment with family caregivers, we need to also understand there are secure attachment patterns and insecure attachment patterns. So this again makes a child vulnerable to develop a lot of behavior problems. If our attachment to our children is insecure, fearful, preoccupied, over-involved, then we have less self-esteem, less coping mechanisms, and we feel less connected. So there is a concept given by the father of attachment theory, John Bowlby, a little bit of a theory I'm presenting here, so that people, if the teachers are there who's listening to my presentation right now, can go back and also read about it. Attachment between parents and children, it's an evolutionary concept. There are 2 types of attachment, as I said. There is a secure attachment and an insecure attachment. I just want to give you an example, like if a child leaves the mother, in a very comfortable manner when the child is very small, like, at the age of 1 or 2 years, and explores the environment. And when he's in trouble, he or she comes back to the father or the mother for comfort, then we say that's a secure attachment style. But in an insecure attachment pattern, the child will leave the parents but would be fearful to come back to their parents, and they'll be too much distant, or they will be anxious and avoid their parents when the parents leave them or they have to leave their parents. They are known as an insecure attachment pattern. And insecure attachment patterns always leads to different kind of problems in life. So effects on adolescents' well-being for the attachment style is that, we have high self-esteem if our attachment with our parents are good. We have closer relationship, we have low psychological issues, lower drug use, lower substance abuse, a lot of problems that you had mentioned right now. The value system is eroding, a lot of problems are occurring. It is because of the attachment style, which is not so secure with the primary caregiver. So these are the different issues that we need to keep in mind, because one is the parenting style, which I said authoritative parenting style and secure attachment styles. If these are the primary basis, on the basic premise, what I can say, on the basis of which a child develops his or her mental health and becomes independent, attached, stable, and the interpersonal relationship also develops, desires intimacy, committed in partnership. But if a person is insecure, the person will be overly dependent, possessive, cold, fear, and has a lot of different kind of activities which are high risk activities, as we can say. So
okay,
this is what I wanted to summarize about the focus of family life in a child's behavior. Thank you so much for this question.
Thank you, Maithili. Thank you for giving us a very detailed, and at times you have taken us to the pure domain of psychology, and it was very enriching for all of us and for the viewers. So it was very enriching. Thank you very much. To give us a very detailed explanation about the role of family and the psychology behind. Now we have another panelist, Mr. Sandeep Datta. He's a postgraduate teacher at JNB, South Pargana, West Bengal. Society again plays a very important role, I think, in the development of a human being, and especially the child who is at the school. So what I find is that society again is not a single component. It has some physical component. It has some resources. It has some networking relationship. So the community relationship and the community resources and the physical environment, all these things together. I mean, and inside these things there are many minor components. Now, because society is again an extended part of the family, and what Dr. Maithili has enlightened us about the family, so is the society. So how a society can play a very important role in the development of the child, very important role in the development of the child, and how the society can add to this triangular relationship between the school and the family and the society. So where is the role, and what is the role of the society towards this? My question is to Sandeep Datta ji. Sandeep Datta, please.
थैंक यू प्रोफेसर रॉय सर। आज जो हम लोग टॉपिक डिस्कस कर रहे हैं वो है सिनर्जिस्टिक रोल ऑफ फैमिली, सोसाइटी एंड स्कूल इन द वेलबींग ऑफ द स्टूडेंट्स एंड द यंग पीपल। ये जो टॉपिक है इसकी शुरुआत में हम लोग देख रहे हैं कि प्रोफेसर हजारिका मैडम ने जो बताया है कि फैमिली का कितना इम्पोर्टेंट रोल होता है, और फैमिली से एक्सटेंडेड एक वर्जन होता है हमारा पूरा सोसाइटी। एक प्रोवर्ब है कि इट टेक्स अ विलेज टू रेज अ चाइल्ड। एक गांव पूरा लग जाता है एक बच्चे को तैयार करने में। क्यों? क्योंकि एक स्टूडेंट, एक चाइल्ड जो है वो सिर्फ अपने घर से अपना रिश्ता नहीं रखता है, वो पूरे समाज से रखता है, वो पूरे सोसाइटी का होता है। तो जिस तरह का एनवायरनमेंट हम एक स्टूडेंट को देंगे, जिस तरह का वातावरण में एक बच्चा बड़ा होगा, उस बच्चे से सोसाइटी को फिर वैसा ही एक फल मिलेगा। अगर उस बच्चे को हम लोग प्रमोट करेंगे, उसको अपने अपॉर्चुनिटीज देंगे जिससे वो अपना विकास कर सके अच्छे से, तो वो बच्चा भी रिटर्न में सोसाइटी को उतना ही कंट्रीब्यूशन देगा। एक चीज हम लोग ये सोचना चाहिए हम लोगों को कि सोसाइटी में जो नॉर्म्स हैं वो फैमिली के थ्रू बच्चे में आ जाती है। उसी तरह से सोसाइटी में स्कूल्स भी होते हैं। तो जिस तरह के सोशल नॉर्म्स होंगे, कस्टम्स होंगे, एटमॉस्फेयर होगा, उसमें बच्चा धीरे धीरे बड़ा होगा। अब वो बड़ा होगा जब, तो वैसे ही वैल्यूज उसके अंदर रहेंगे जो उसे बचपन में मिले होंगे। हम लोग ये देखते हैं कि जहां पर सोसाइटी का एक बहुत पॉजिटिव अप्रोच रहता है बच्चों को बड़ा करने में, सिर्फ ये नहीं देखा जाता है कि एक फैमिली की रिस्पॉन्सिबिलिटी है कि एक बच्चा को कितना अपॉर्चुनिटी मिल रहा है, वो कितने अपने आप को आगे बढ़ाने के लिए कितने उसके पास मौके हैं। अगर पूरी कम्युनिटी साथ में आ जाती है बच्चे को सपोर्ट करने के लिए, स्कूल्स को सपोर्ट करने के लिए, कोई एक फैमिली है जो अगर ब्रोकन फैमिली है, उसमें कोई बच्चा है, उसको सपोर्ट करने के लिए अगर समाज के लोग सामने आ जाते हैं, तो वो ऐसे फैमिलीज के जो बच्चे हैं उनको भी उतने ही मौके मिलेंगे जो कि दूसरे जो वेल टू डू फैमिली है वहां पर मिलते हैं। हम लोग ये देखते हैं कि सोसाइटी का एक एटीट्यूड भी होना चाहिए जिसमें बच्चों को आगे बढ़ने के जो मौके हैं वो अच्छे से मिल पाए, इसको इंश्योर किया जा सके। कम्युनिटीज जो इन बातों को बहुत इंपॉर्टेंस देती है, वहां पर हम देखते हैं कि बच्चों में डिसिप्लिन आता है, उनको हमेशा मोटिवेशन मिलता रहता है अपने आप को आगे बढ़ाने के लिए, कुछ अचीव करने के लिए और एक्सेल करने के लिए। किसी भी फील्ड में आगे बढ़ने के लिए मोटिवेशन चाहिए। सिर्फ अगर फैमिलीज के तौर पर हम लोग एक देखें तो हो सकता है कुछ फैमिली इतने ज्यादा उनके पास रिसोर्सेज नहीं है अपने बच्चों को सपोर्ट करने के लिए। पुराने समय में भी और अभी भी फिलैंथ्रोपी एक बहुत बड़ा एक कंट्रीब्यूशन है, जहां पर एक सोसाइटी में जो लोग वेल टू डू फैमिलीज के हैं वो अपने जो रिसोर्सेज है वो शेयर करते हैं सोसाइटी के साथ, ताकि दूसरे जो डिप्राइव कम्युनिटी के बच्चे हैं, ऐसे फैमिलीज जिनके पास रिसोर्सेज की कमी है, उन फैमिलीज के भी बच्चों को पूरे मौके मिल सके। एक तो गवर्नमेंट का भी रोल हो जाता है और गवर्नमेंट भी सोसाइटी से निकल कर ही आती है। अगर हम लोग डेमोक्रेटिक एनवायरनमेंट को प्रमोट करेंगे तो उस तरह के जो वैल्यूज भी है बच्चे में आएंगे। साथ ही साथ जहां पर हम लोग देखेंगे कि बच्चों को अपने फैमिली से पूरी तरह से सपोर्ट नहीं मिल पा रहा है, जहां पर हम लोग देखेंगे कि रिसोर्सेज अवेलेबल नहीं हो पा रहे फैमिलीज के तौर से, वो उन जगहों पर सोसाइटी का काम बहुत इंपॉर्टेंट हो जाता है। वो फिलैंथ्रोपी हो सकता है या तो गवर्नमेंट सपोर्ट हो सकता है। नॉन गवर्नमेंट एजेंसीज जो है वो भी कम्युनिटी के मेंबर से ही बनती है। तो कम्युनिटी के जो मेंबर्स है, सोसाइटी के जो मेंबर्स है, वो आगे आकर बच्चों को सपोर्ट करने के लिए पूरी तरह से कोशिश करेंगे। और एक चीज हम लोग देखेंगे, तो पॉजिटिव जो एटीट्यूड की बात है वो मैं इस पर जोर दे रहा था। अगर नेगेटिव एटीट्यूड है सोसाइटी में जो डिस्क्रिमिनेशन को प्रमोट करता है या इनइक्वालिटी को प्रमोट करता है, उन केसेस में भी बच्चों पर बहुत ज्यादा गलत इफेक्ट पड़ता है। उनको वो मौके नहीं मिल पाते हैं, शायद उनका जो मेंटल वेलबींग है वो भी हैम्पर हो जाता है डिस्क्रिमिनेशन की वजह से। उनको मौके मिलने चाहिए थे ऐसा उनको लगता है, लेकिन सोसाइटी के जो इनइक्वालिटीज है वो उन्हें आगे बढ़ने से रोक देती है। हमारे देश में जैसे कास्ट एक बहुत बड़ा बैरियर है। अभी रिसेंटली एक न्यूज में हम देख रहे थे कि जाति सूचक शब्दों का इस्तेमाल किया गया किसी बच्चे के खिलाफ और वो बच्चा बहुत ज्यादा परेशान हो गया। इस बारे में कम्युनिटी के लोगों से बात की गई और जहां पर ये समस्या आई थी उसको सुलझाने की कोशिश की गई प्रशासन के तौर पर। अब इन सब जो कंडीशंस आ जाती है उसमें सोसाइटी का बहुत बड़ा रोल बन जाता है। कभी भी ऐसा एक नेगेटिव एटमॉस्फेयर में अगर एक बच्चा आ जाता है, सोसाइटी के सारे मेंबर्स को आगे बढ़ना चाहिए, कम्युनिटी को आगे बढ़कर हेल्प करना चाहिए ताकि इस तरह के डिस्क्रिमिनेशन से, इनइक्वालिटीज से बच्चों को बचाया जा सके। और एक चीज हम लोग देखना हमें चाहिए कि डेमोक्रेटिक सोसाइटीज बहुत ज़्यादा वैल्यूज इंकलकेट कर सकते हैं अपने आने वाले फ्यूचर में। तो सोसाइटी जितना इन्वेस्ट करेगी फैमिलीज और स्कूल्स के साथ सिनर्जी में मिलकर आगे बढ़ने की कोशिश करेगी और बच्चों को प्रमोट करेगी अपने अपॉर्चुनिटीज के साथ, ताकि वो एक्सेल कर सके, अचीव कर सकते हैं अपने लाइफ के जो भी उनके गोल्स हैं, तो आने वाला जो कल रहेगा एक देश का वो बहुत सुनहरा होगा। तो गोल्डन फ्यूचर के लिए अभी हम लोगों को ये करना चाहिए कि सोसाइटी के तौर पर, एक कम्युनिटी के तौर पर बच्चों को सेफ गार्ड करना है, उनके मेंटल वेलबींग को प्रोटेक्ट करना है, उनके इमोशनल डेवलपमेंट को सस्टेन करना है, हेल्प करना है, ताकि हमारा आने वाला जो देश का भविष्य है वो सुनहरा हो सके। जी सर।
धन्यवाद संदीप जी। आपने बहुत ही अच्छे ढंग से जो समाज का जो दायित्व है बच्चों के पालन में, बच्चों के विकास में, उस पर आपने बहुत ही बढ़िया ढंग से प्रकाश डाला है। And it was simply wonderful because you have touched the nerve, and because society is closely linked to the development of the child and human being, and a school is situated in the social context. It is always situated in the social context, and you have nicely elaborated upon how the social groups, the dynamics there, the governance there, the other organizations there, how they can play a very, very positive and important role, a cohesive role to help develop the child in a better way so that we can achieve the educational goals through them. I think wonderful deliberation, Sandeep ji. Thank you very much. Now we have with us Mr. Aaron Warzari. He is the principal of Shillong Public School. This is a school, very, very big school in Shillong, and he is heading that school. He is with us, and because he is into administration as well as into the school practices, I think it is a great opportunity for all of us to know something from the ground, something from the schools. Sir, for last couple of years, when the entire world, it was halted for some time, and things were quite disturbed. Life was quite disturbed. There was chaos in the society and in the governments, and not only in India, throughout the world, and we have seen that. And the most sufferer among them was the child, the school-going child, because schools were closed and they had nothing to do. Children had nothing to do. They were sitting at home, and because of home and because of some alternative mode of teaching and learning through online mode, I mean, that was also, I think, at times that that did not help much, and that also created some problem with children. And it was not for 1 month or few days or say half year or so. It was it continued for a couple of years. So it was a long period, and it affected a lot. How do you perceive this impact, rather the negative impact on children as a head of the institution? How do you find the negative impact of this period, pandemic period, on children in the schools, when now they are coming back slowly to schools? How do you find the negative impact? How do you perceive the negative impact on children's growth?
Indeed, Professor Subhash, first of all, let me just greet my fellow panelists. A very good afternoon to all. Indeed, this pandemic and the 2 years lockdown did have a very, very large negative effect upon not only the children, but even we as adults. And you can imagine the impact on the children, especially children living in urban areas, where for 2 years, For 2 whole years, they had no access to the friends, to their surrounding. So as a result, when they came back to school, so in 2022, when we had formally open school on a normal basis, we could see that there has been a lot of changes among school children. I speak this from experience as a principal of a school. Perhaps Dr. Maithili, she can generalize this with how the trend is among the young people all over the country, but I'm just talking as a personal experience which I will share now of what is happening with the children in my school as well as some other schools with which I have had the pleasure of interacting with other principals. And this is what we have more or less come to conclude, that first and foremost, one of the negative effects that the pandemic and the subsequent lockdown that we have had for the 2 years has been that when the children are coming back to school, most of them are withdrawn and shy. In the first day itself, you can make out that children are very, very hesitant to talk to one another. They are very, very hesitant to interact in a group, and they mostly keep to themselves. That is one aspect which I've seen. The second aspect is that the children are socially unable to cope up in a group, especially children coming from nuclear family. What we have noticed is that many of these children, single children, are unable to behave in a group. And as a result, we have children who have become very, very aggressive, maybe because of the fact that for 2 years they have not had any interaction with other children, and purely they have only interaction with adults. So they have become very, very aggressive. And we had a lot of fights in the school, which we normally don't have every year. I mean, of course, you do have the odd fights now and then, but for something to happen on a regular basis, and for some of them we had to call the parents and explain that your child is exhibiting very, very violent behavior to the extent of using sharp objects like pencils or pens to poke other friends. So that is something which we have noticed in this school as well as in other schools. Then thirdly also, we have seen that children are coming back to school with very, very short attention span. Normally you can have a good teacher can hold the attention of the entire class for 30, 40 minutes. Children will listen in rapt attention. Children will respond when questions are being asked. But today's child, in the present scenario, children have very short attention span. Within 10 minutes, this attention span is gone. And as a result, children, they are into daydreaming, their mind is somewhere else. So this is something which we've also noticed. And if the teacher is unable to grasp the attention of the child within those 10 minutes, then his whole teaching period is thrown away. It will be very, very difficult for him to capture the attention span of these school children. Then fourthly, which is very, very common, and I understand this very well, because of the pandemic, the sleeping pattern of children has gone for a toss. And as a result, we have very, very sleepy children coming to school. We have children who come to school who have difficulty in coming to school on time because their sleeping pattern has really been disrupted in the last 2 years. So we have children who are always sleepy in the classes, children who come late to school because they could not wake up in time. So this is a very, very common phenomenon in many, many schools. And in the many interactions I've had with other schools, it is a very, very common phenomenon. And one thing which I find very, very disturbing is that the children are, whenever we have even a simple class test, children easily resort to cheating. Perhaps it is because in the last 2 years, children were simply taught on online mode, examinations were given on online mode, and it becomes very, very easy for children to consult their books or consult their notes whenever the exam is given in an online mode. And perhaps parents were not able to really monitor the children during that period. So children, it became a pattern for them. So even the exams, even with the children who are quite brilliant in the classes, these children will resort to cheating, to using unfair means. It's something which is very disturbing, which is also seen in other schools, and which we are at the moment addressing it on a very, very high priority. Then another disturbing sign which we've seen is that children are exhibiting a lot of depression. We have had cases even to the extent that a few of the students which we've had are exhibiting manic depression. Children are cutting themselves, children are hurting themselves, which we had to refer to a psychological center here, because these children were on the verge of doing something very, very hurtful to themselves, something very, very terminal to their lives. So these children came from family whose lives were disrupted due to COVID. These families, some of them have passed away, and in many cases, which I have personally come to know, is that these children were also isolated during the COVID, during the pandemic. So as a result of that, they did not get to say goodbye to their loved ones. They could not be there when their loved one passed away. Some have lost parents, some have lost grandparents, some have lost brothers or cousins or sisters. So as a result, they became very, very sensitive, and often in 2 or 3 cases that I know, they have become very, very showing very, very severe cases of manic depression. And then we also have a very common aspect, which is, I'm sure, seen all over, in families all over and in schools all over the country, as well as the world. Children are becoming addicted to mobile phones, to social media. Mobile phones, I can understand, because in the last 2 years, we had to resort to online mode of teaching, learning, and as a result, parents had to buy mobile phones for the children. And ultimately, that mobile phone became something, especially at a young age, children are easily addicted to mobile phones. And as a result, today we have a lot of children, even though mobile phones are today banned in the school, yet students are bringing mobile phones to school. Students are, opening up the mobile phones to look at videos, to look at this, to look at that, which is becoming very, very distracting. And the many, many parents which I have interacted have also told me that even during studies, their mobile phones are always with them. And as a result, the studying pattern is also disturbed because the constant attention being paid to their mobile phones. So these are some of the changes which we have seen among the young people, which normally are seen in a few of them. But what I'm saying about now is that these cases are becoming on a regular basis, and the numbers are increasing day by day. So these are some of the negative aspect, the negative effect that the pandemic has had among our school children.
Thank you, Mr. Aaron Warzade, for highlighting the negative impact of pandemic on children, and especially you have mentioned some psychological issues which have cropped up because of the pandemic and afterwards. So, and because you are from the field and you are an experiencing principal as well as teacher, you are running a school. So, this is a hard truth, I would call it. So, thank you very much for elaborating upon it. And now I would like to go to Dr. Maithili again, because the psychological issues are coming up more and more these days. But to my mind, some of these psychological issues are not the only product of this pandemic, but they are very much there in the life of modern time. So, and it's very horrifying at times, and especially with children when they suffer from those psychological problems. What I find is, very often we see that the kind of loneliness or the sadness or the mood disorder, or to a great extent might be leading to depression or anxiety or some other behavioral issues. At times it leads to the substance misuse and other behavioral issues. And it's a very common, and now it has reached the villages also in this country. That is a very serious issue for the educationists and the psychologists and sociologists and politicians to handle. What I find is not only this, when we look at education as a whole, we find that in this 21st century and the coming years, what we lack is that now it's no more the emotional balance and emotional quotient kind of thing. Now we require more the social quotient. We require more the adversity quotient. We require more the capability of resilience, and that these skills are highly needed these days, and which our children are not getting, neither from the school, neither or not from the society or family. I mean, something like that. So just I would like to request Dr. Mathli, how do you reflect on this, the very role of family here? Because you have touched all the important points about the security or the trust and other theories you have just elaborated upon. Okay, fine. But I think because the journey starts from the family of a child, so a family's role to curb these challenges and issues in children's life, I still believe that matters the most. So how do you perceive, reflect on this?
Yeah, thank you so much for this question. And going back to Mr. Vajra's presentation, yes, during the pandemic, we had come across real issues. We are still dealing with those grief issues in children, and it has been really a difficult time for us. I myself had run the mental health task force in Assam. We had, in the first 6 months, around 406 counselors. We had counseled COVID-19 patients with COVID-19, 76,000, which has come out in World Health Organization Bulletin also in September 2021. They have quoted about me and what we had done during pandemics, and also about the child cases. If you want, Mr. Vajra, you can go through that. And yeah, thank you for that. And just wanted to throw some insight about certain cases that I have written here, because children's issues are not only due to the pandemic, and rightly said, there has been issues of delays and disabilities as well as disorders in children, and somehow we see it's rising, or it may be that people nowadays are aware, so they come to us more often than they were before. So like there are certain issues in the assignments of children, in the school assignments, that a child of 7-year-old forgetting homework assignments, doesn't attend to teachers' lectures, as he had said about inattention, hyperactivity, showing disinterest. But she looks thin and malnourished, and she also says that she's not happy, and she even thinks about dying. So these are certain indicators that we have to be very, very aware and have insight about child psychology and child mental health issues. There's another case like, a Rahul, 3-year-old who cannot speak, is always aloof, very sensitive to touch. When someone calls him, he doesn't even look. He keeps fidgeting in the classroom, and maybe he has a childhood pervasive developmental disorder, that is a neurodevelopmental disorder known as autism. So we have to know about that. So how to do intervention with such a child. There's another child called Arun who is in the 2nd standard. He disturbs the child. He often submits his work late, incomplete, cries, and has bedwetting since birth. So he does well in sports. Like maybe this person has a learning disability, and that has to be identified very early in life. So many times we do not identify children's issues very early, and then it becomes very chronic later on. And when they come to us at the age of around 10, 11 years, it becomes very difficult to start with the intervention. So it is always insightful for us that to understand that child issues are curable. It's not that it's preventable also. First, it is preventable, then it is curable. So we need to start anything that we see damaging for the child as well as other people, immediately resort to some kind of intervention. There is the 17-year-old remaining out indoors, refuses to take part in any social occasions, as he had said. She's always fiddling with the cell phone, doesn't eat anything, always till past midnight, she's with the phone. So nowadays there's a concept of behavior addiction that is coming up. Before we had substance use, before we had alcohol, pornography addiction. Now there is a concept of gaming addiction or behavior addiction, and these have to be treated. I mean to say, we cannot say that pandemic had made them very online friendly and they have to be with the gadgets, so we can't help it. It's nothing like that. We have certain scales to assess internet addiction and phone addiction, cell phone addiction, and stuff like that. So all those kind of problems that I said needs a kind of a assessment that we do. We psychologists, we take history from the parents, caregivers. We have interview schedules. We ask questions in a particular manner. We also see the activities of the children. How are they playing with other people? As he had rightly said, they have started playing alone. Maybe they have become very solitary. They do not know how to live in groups, because that kind of 2 years is a long time for them to again forget what they had learned. So we have to make them relearn what they had forgotten, maybe. So those are the skills that we have to teach them. There has to be some mental status examination, developmental assessment that we do. So what we need to understand is that when a child is born, the child has to reach certain milestones between the age of 0 to 1 years. Like, for example, the child has to play with himself, maybe walk, talk, monosyllable sentences. And these are the different milestones the child has to achieve. But if the milestones of social, language, cognitive movement, having friendship, capacity to communicate with other people, ability to think, understand, memorize, information processing is not there. If all these are lacking, then definitely we have to understand that something is wrong with the child. And so the birth to 5 years age level, we call it the developmental age level, but the developmental problems happens in the child. So early intervention always helps, and the parents needs to focus on that, how to develop the child's sensory processes, give a lot of stimulations to the child, because we cannot have these red flags, and we cannot delay the intervention process, because behaviors or delays that signal a possible problem with development, and so evaluation is required. But now coming to the normal difficult behavior, people have talked about moodiness, less affection, preoccupation with sex, cigarettes, alcohol, experimentation, being self-conscious, extremely self-involved. These are very normal behavior, very, very difficult behavior. But when do we have to actually, intervene in a child? When a child and adolescent is using alcohol, drugs, mobile gaming, increased use of that, anxious, depressed, suspicious, has some promiscuous sexual behavior, lying, stealing, destructive, poor school behavior, persistent negative attitude, frequent temper tantrums, extremely fearful, and if they are self-mutilating, doing some kind of self-harmful behavior, then definitely we have to intervene and always think that they need help. These children are crying for help. They need somebody to come to them to do something about them, because they might have suicidal ideas. And we have seen that childhood suicidal risks or childhood suicide is very high. People think that children doesn't get depressed. Children will never commit, suicide, because they do not know what is depression. It is not true, because this is it's a behavior problem. It's an emotional problem. It is a disease that can affect at any point of time. So the genes and the environment has an effect on the child's development as well as the child's behavior problem. So all these things needs to be known, because the biochemical factors of the brain has an implication. So the medicines help. So the psychiatrist needs to be involved here, as Sir had said about, inattention. Inattention and hyperactivity needs to be, taken care with medication. Only counseling is not going to help. He had talked about manic depressive psychosis. Counseling is not going to help. Definite medicines will be required. But the environmental factors like abuse, low socioeconomic status, as the other panelists have rightly spoken about, which makes us deprived of many things in life, overcrowding, parental criminal behavior, maternal psychiatric issues, foster care placements, all these are environmental factors which can be reversed with counseling and some other techniques. So what we need to also understand is the parent psychopathology. If the parents are having any psychiatric issues, then how to deal with that? First, the parents are to be stable in order to take care of children's issues. So many times whenever a child comes to us, we not only see the child, we take a family system approach. The whole family is treated by us because it's a synergistic approach. Anyone's behavior gets impacted by every other's behavior. So the concept of a resilient child, as is talked about, it is very, very important for us to understand that how to build up resilience in children, because the risks are very high in today's world, but how to make them very resilient to overcome these difficulties. You know, how to adapt to changes, how to form nurturing relationship, ability to distance from social emotional chaos, and how to develop the social intelligence and to use problem solving methods. The first certain, some slides I'm giving here just to give a comparison about different kind of parenting styles, which I've already spoken about. But in these kind of children where there are problems in the children's behavior, we should not criticize. You know, this is something which we need to always understand. We should not compare children with anyone else. We should not be judgmental. We should always encourage them to have healthy eating habits, physical activity, enough sleep, as he has rightly pointed out. We also have to be very understanding about the need for space and privacy of children, and very honest and accurate information about anything and everything in life to children. We should be very open in our communication and be very patient of excessive time spent on different activities. So we need to also educate ourselves. You know, parents has to go through a lot of seminars of this kind and also keep them updated, because as I said, the family is evolving concept. So we need to always educate ourselves, talk to the children about the changes that is happening, and create an atmosphere of respect, trust, and honesty, and put ourselves in your child's place. That is empathy. We should know from the child's perspective what the child is going through. And we also need to share our experiences as children, how we were and what kind of mistakes that we had done in our life. And we should pick our own battles. So maintain our level of expectations from our child, and do not always say that the child, he's just a child, because many a times we just negate, we just, don't give importance to any negative behavior. And we just say he's just a child, so he'll do anything. No, we need to know the standards of the child. We need to know the age-specific behavior of a child. Then only we can say he's just a child, because we need to nip it in the bud, as we say in behavior therapy. Anything that you see, you need to really intervene and address immediately. So early intervention and early, insightful learning is always important. We also should know about the child's friends and keep track of their activities, because that's very important. And also the warning signs about risky behavior, and respect the child's privacy and set boundaries and make rules very appropriate. This is about a survey, as Sir had said, that the prevalence of mental disorders in children is increasing day by day. It's like nowadays what we see is 13.5%. Now, even in the pandemic, there was a 20% increase of the mental health disorders. Otherwise, the common mental health disorders like anxiety and depression is otherwise only 10%. But during the pandemic, it has really, really increased to manifold times. So we need to recognize the major behaviors, and what we need to do is educate ourselves and give proper reference. Whom to refer, how to refer, when to refer. That is very, very important for all of us to know, all the stakeholders. I think this is what I wanted to present. Yeah.
Thank you, Dr. Matley, to give us a lot of information, especially from the clinical perspective, what I could get it. But there are many points for parenting also and for families also, I believe so. So it's wonderful. It's a very good elaboration on the psychological issues and how to address this kind of issue in the family and around. Now, I would go to Mr. Sandeep again. Sandeep, you talked about the role of society. What I taking you from Dr. Matley's deliberation, I find that the role of society is very, very important in the in the development of any human being, for that matter. And the society in India is not one. It's very diverse. And many things what we have got from Mathley's inputs and from Mr. Aaron's deliberation, I think they are applicable to a particular situation where parents are educated and where there is some kind of good environment around what we call it as a part of society, where the resources are to some extent resources are available, and to some extent some kind of networking relationship in the society exists. But think of the vast country like India, where a major chunk lives in the rural areas, where we don't have educated parents. We have daily wages, and we have migrant laborers, and their children, they are coming to school, and mostly they are going to government schools. And how do you find that when there is a resource crunch around, there is no proper schooling, when there is no proper facilities available around in the society, when there is no system existing per se in the society to provide the required facilities to the proper growth and development of children in that society, how do you think that the society should address, the country should address this issue for the holistic development of the child? Mr. Sandeep, my question is to Mr. Sandeep.
Sandeep ji, please unmute yourself.
थैंक यू सर। आपने जो पॉइंट यहाँ पर रेज किया कि सोसाइटी पूरी तरह से बच्चों को कैसे सपोर्ट कर सकती है, जहाँ पर हम लोग देख रहे हैं कि बहुत ज़्यादा इनइक्वालिटीज़ है हमारे देश में, और जो सोसाइटल नॉर्म्स है वो बहुत वेरी कर रहे हैं रीजन टू रीजन। मैं नॉर्थ ईस्ट में कुछ दिनों काम करने का मुझे मौका मिला था। मैंने वहाँ देखा कि सोसाइटी का बहुत बड़ा इम्पैक्ट होता है वहाँ पर बच्चों पर, स्पेशली ट्राइबल सोसाइटीज का। बच्चों पर वहाँ पर सिर्फ पेरेंट्स का कंट्रोल नहीं होता, बल्कि ट्राइब एज अ होल पूरी तरह से बच्चों को रेस करती है। ट्राइबल में जो बड़े बड़े एल्डर्स होते हैं, उनके पीयर्स होते हैं, उनके साथ बच्चे बहुत ज़्यादा घुलकर मिलकर बहुत सारी चीज़ों को एक्वायर करते हैं, नॉलेज को एक्वायर करते हैं, जो उनको लाइफ टाइम में बहुत सपोर्ट करती है। उसके अलावा हम लोग दूसरी तरफ सोसाइटी देखते हैं जहाँ पर शायद बच्चे बहुत अलग थलग से बड़े होते हैं, इतना कोहेसिवनेस नहीं होता है उन सोसाइटीज में। तो ये जो पूरा पॉइंट है कि सोसाइटी किस तरह से बच्चों को हेल्प करेगी, ये सोसाइटी के स्ट्रक्चर पर भी बहुत ज्यादा निर्भर करता है। अगर सोसाइटी बहुत ज्यादा मॉरल एजुकेशन पर फोकस करती है तो हम लोग देखते हैं कि बच्चों में भी वो वैल्यूज अपने आप आ जाती है। अगर सोसाइटी में वायलेंस बहुत नॉर्मल माना जाता है तो बच्चे भी वो एट्रीब्यूट एक्वायर कर लेते हैं। तो सिर्फ फैमिलीज या स्कूल का जो सिचुएशन है वो बच्चों को इन्फ्लुएंस नहीं कर रहा है, बल्कि एज अ सोसाइटी, एक कम्युनिटी, एक लोकेलिटी जहां पर बच्चा बड़ा हो रहा है, वो भी बहुत हद तक जिम्मेदार है कि आने वाले दिनों में हमारे सिटीजन्स कैसे होंगे। अगर हम लोग डाइवर्सिटी की बात करें हमारे देश में, हमारा देश एक डेवलपिंग कंट्री है, तो यहाँ पर बहुत सारे चैलेंजेस हैं। प्रोफेसर रॉय सर ने एक बहुत इंपॉर्टेंट मुद्दा उठाया माइग्रेंट लेबर्स का। इनके फैमिलीज बहुत ज़्यादा इधर उधर फैले रहते हैं, कभी कभी बच्चे भी अपने पेरेंट्स के साथ मूव करते रहते हैं। हम लोग देखते हैं कि उत्तर भारत से दक्षिण भारत चले गए या फिर दक्षिण भारत से कहीं और आकर फैमिलीज अपने काम की खोज में आकर रहने लगती है। तो जो ट्रेडिशनल सेटअप है सोसाइटीज का, उससे एकदम अलग हटके एक अनजान, एक नए एटमॉस्फेयर में बच्चे आ जाते हैं और फिर धीरे धीरे वहीं पर बड़े होते हैं। वहाँ जैसा कल्चर उन्हें मिलता है उसके साथ वो ढलना सीख जाते हैं और जो ट्रेडिशनल उनका सेटअप है उससे काफ़ी दूर हो जाते हैं। फिर जब वो लोग वापस अपने मूल जो इलाका है वहां पर लौटते हैं तो शायद एडजस्टमेंट प्रॉब्लम्स उनको देखने के लिए मिलता है। एक इम्पोर्टेंट जो चेंज आया है आने वाले दिनों में, डॉक्टर मैथिली ने भी इसको पॉइंट आउट किया, प्रोफेसर रॉय और मिस्टर एरन ने भी इसको पॉइंट आउट किया कि कोविड-19 एक बहुत बड़ा चेंज मेकर होकर आया हमारी सोसाइटी में, जहां पर बच्चों में रेडिकल चेंजेस हम लोगों को देखने के लिए मिल रहा है। स्कूल गोइंग जो हमारे स्टूडेंट्स हैं, उनके बिहेवियर, उनके जो एक्सप्रेशंस है, वो पोस्ट कोविड जो दौर अभी शुरू हुआ है उसमें बहुत ज्यादा चेंज हो चुके हैं प्री कोविड टाइम के अगर हम लोग तुलना करें। बच्चे टेक्नोलॉजी में काफी हद तक आगे बढ़े हैं, मोबाइल से काफी उन लोगों का क्लोजनेस बढ़ा है। जितना मोबाइल से क्लोजनेस बढ़ा है उतना सोसाइटी से या अपनी फैमिली से बच्चे दूर हो रहे हैं। आप ये चीज देख सकते हैं कि पहले बच्चे खेलने के लिए मैदानों में जाते हैं, आज भी बहुत सारे बच्चे जाते हैं, लेकिन ये भी दिखने को मिलता है कि बच्चे मैदान में जाकर एक साथ बैठ के सिर्फ मोबाइल में अपने अपने जो सोशल नेटवर्किंग का जो काम है उसी में वो लोग लगे रहते हैं। गेमिंग में बच्चे बहुत ज्यादा इन्वॉल्व हो रहे हैं। आज ये एक बहुत बड़ा इशू बन रहा है मेंटल हेल्थ को लेकर, या उनके जो साइकोसोशल जो डेवलपमेंट है उसको भी काफी हद तक इफेक्ट कर रहा है। सोसाइटी को इसको एक्नॉलेज करना पड़ेगा, ये एक इशू है, इसको एड्रेस करना पड़ेगा और बच्चों में इन सब चीजों के बारे में अवेयरनेस जगाना पड़ेगा। बच्चों के साथ
I think Mr. Sandeep is disconnected for the time being. So I will go to Mr. Aaron Wardsley, sir, again. Sir, you are heading one school and you must be a teacher also primarily. And, in a school system, of course, in any higher education or for that matter, any system, there is a concept of discipline, and the concept of discipline, even as a student of education, I could not understand it properly so far. What is the concept of discipline? Once I read that, okay, in 16th century, when Samuel's poem, it talks about spare the rod and spoil the child. And now in this 21st century, we are here. A lot of changes has taken place in the concept and nature and practice of discipline in the institutions, educational institutions especially. And we have different schools of thoughts also, and based on the schools of thoughts, say the idealistic school of thought, or the naturalistic school of thought, or the pragmatistic school of thought, and they have different interpretation for disciplining the child. What is your take on this? I because being a practitioner, how do you perceive this discipline, and what are the alternative strategies you are adopting in your school, particularly as a very enlightened headmaster or principal of the school? What are the alternative strategies for disciplining your students there in your system you are adopting? Because recently I have read that USA, in some province, now they have decided, in a particular province, I am forgetting the name, they have decided that again the corporal punishment they will go for. Some riders are there, but they would go for the physical punishment. So what is your take on the concept of disciplining in the school system? Again, we lost the connection with Mr. Aaron also. Is Sandeep there?
Yes, sir.
Okay, so you can continue. You wanted to say something more?
Yes.
Please go ahead.
पता नहीं नेटवर्क का थोड़ा प्रॉब्लम हो
हाँ,
गया
कोई बात नहीं, आप जारी रखें।
मैं जिस बारे में डिस्कस कर रहा था, हमारे सोसाइटीज में एक बहुत बड़ा चेंज आया है कोविड के दौर के बाद से, और हम लोग ये देख रहे हैं कि हमारे जो स्टूडेंट्स है वो कहीं ना कहीं हमारे जो अपने जो एक ट्रेडिशनल जो सेटअप था उससे काफी अलग हटके एक मॉडर्न टेक्नोलॉजी बेस्ड एक सेटअप में बहुत ज्यादा यूज हो जा रहे हैं हमारे स्टूडेंट्स। पहले बच्चे खेल कूद के लिए मैदान में जाते थे, आज भी जा रहे हैं, लेकिन हम लोग देख रहे हैं कि मैदान में जाकर भी वो अपने सोशल नेटवर्किंग साइट्स में ज्यादा इन्वॉल्व होके एक जगह बैठे हैं बच्चे साथ में, सब अपने अपने मोबाइल में ही देख रहे हैं। तो ये कहीं ना कहीं एक अपने आप को दूसरों से अलग एक परसीव करना या अपने दायरे को छोटा कर लेना, ये ऐसा एक माहौल बच्चों को मिल रहा है। हम लोग ये देख रहे हैं कि इससे बच्चों के जो बिहेवियर है उसमें बहुत बड़ा एक चेंज आ गया है। शेयरिंग की जो एक कॉमन जो फीचर्स होती थी बच्चों में वो कहीं ना कहीं बहुत कम होती जा रही है। एक दूसरे के जो प्रॉब्लम्स को एक्नॉलेज करना बहुत ज्यादा जरूरी होता था, अभी बच्चे उन चीजों को समझ नहीं पा रहे हैं। कोविड के टाइम पर जब बच्चे अपने घरों में बंद थे, उसके बाद अभी सोसाइटी में फिर वो लोग नॉर्मलसी की तरफ आगे बढ़ रहे हैं। तो इस दौर में मैं ये कहना चाहता हूँ कि हमारे सोसाइटी के जो कम्युनिटी के जो लीडर्स हैं या किसी विलेज में जो एल्डर्स हैं, उनको इन सब इश्यूज को लेकर अवेयरनेस को बढ़ावा देना चाहिए। फैमिलीज, स्कूल्स और कम्युनिटी लीडर्स जो है सबको एक साथ मिलकर इन इश्यूज को, इन चैलेंजेस को लेकर बैठना चाहिए, इसमें डिस्कशंस होने चाहिए ताकि बच्चों में फिर से उन्हीं चीजों के बारे में समझाया जा सके। और एक चीज इंपॉर्टेंट है कि ये जो सोसाइटी का जो एक बहुत बड़ा इंपॉर्टेंट रोल है सोशल वेलबींग को प्रमोट करने में बच्चों में, तो सोशल वेलबींग जो है हेल्थ का भी एक बहुत बड़ा इंपॉर्टेंट डायमेंशन है। इसे WHO भी मानता है, अपार्ट फ्रॉम द फिजिकल फिटनेस एंड मेंटल अलर्टनेस। तो फिजिकल, मेंटल एंड सोशल वेलबींग एक साथ होने पर बच्चों में पूरे जो हेल्थ के जो सभी डायमेंशंस है वो ठीक तरह से आगे बढ़ सकते हैं बच्चों में। अब सोसाइटी को अभी जिस बारे में ज्यादा से ज्यादा फोकस करना चाहिए वो ये है कि बच्चों में इन सब भावनाओं को बढ़ावा देना है ताकि वो लोग सस्टेन कर सकते हैं मीनिंगफुल रिलेशनशिप अपने पीयर्स के साथ, अपने फैमिली मेंबर्स के साथ। उनको तैयार किया जा सके कि वो रिलेशनशिप जो है उसको कंटिन्यू कर सकते हैं अपने दोस्तों के बीच में और अपने दायरे को बढ़ा सके। और इसके साथ और एक इम्पोर्टेंट चीज होगा कि बच्चों में प्रॉब्लम सॉल्विंग स्किल्स जो है वो भी बढ़ेगी। सोसाइटी में ये भी देखना है कि अगर कोई बच्चा अलग थलग हो रहा है किसी भी कारण से, जैसे अभी कोविड का दौर चल रहा है उसके बाद का, तो बच्चों में प्रॉब्लम सॉल्विंग जो स्किल्स है जो आने वाले दिनों में उनको तैयार करेंगे सोसाइटी में अपने रोल को प्ले करने के लिए, इसके लिए भी उनको तैयार करना पड़ेगा। तो अवेयरनेस लाना आज के दौर में बहुत ज्यादा जरूरी है। और ये भी हमको देखना है कि जो वायलेंस है जो सोसाइटी में कहीं कहीं पर दिख जाता है, या तो समाज में है या स्कूल्स में है या कहीं कहीं फैमिलीज में है, इन सब चीजों से बच्चों को दूर रखा जाए, उन्हें कहीं ना कहीं बढ़ावा दिया जाए कि वो एक हेल्दी रिलेशनशिप अपने आसपास के लोगों के साथ बनाकर रख सके और वायलेंट बिहेवियर से दूर रहे और सबके साथ एक कोहेसिवनेस के साथ वो लोग रहने की कोशिश करें, सीखे इस सब चीजों को, ताकि सोसाइटी में जो पीस है उसको भी बनाए रखा जा सके।
संदीप, मैं यहाँ एक थोड़ा सा और आपसे जानना चाहूंगा कि समाज, एक बच्चा जो होता है वो पूरे समाज की जिम्मेदारी होती है, और समाज का ये काम है कि मान लीजिए कि एक रास्ता जो घर से स्कूल तक पहुंचता है उस रास्ते के बारे में सोचे। समाज की यह जिम्मेदारी होती है कि उस समाज के अंदर जितने सारे अलग अलग तरह के ग्रुप्स हैं, जो कास्ट के आधार पे, रिलीजन के आधार पे या और किसी चीज के आधार पे, उस बीच में जो एक इंटरेक्शन है, एक मधुर संबंध है, वो दिखना चाहिए, एक अच्छा माहौल होना चाहिए। इसके साथ ही समाज में, समाज के अंदर, उस कम्युनिटी में, उस समाज में एक अच्छा स्कूल होना चाहिए स्कूल दुरुस्त होना चाहिए, उसके शिक्षक दुरुस्त होने चाहिए, समय पे आना चाहिए, स्कूल के अंदर सुविधाएं होनी चाहिए और समाज के अंदर में भी पढ़ने लिखने की सुविधाएं होनी चाहिए। और इसके लिए जो हमारी व्यवस्थाएं हैं, जो पंचायती राज मान लीजिए कि सिस्टम है, छोटा सा कोई एनवायरनमेंट से संबंधित क्लब है, कोई लाइब्रेरी है, कोई और संस्थाएं हैं, ये सब भी इसमें कैसे मिल करके बच्चों के विकास के को ध्यान में रख करके, खास करके हम जो शहरों में देखते हैं, अमूमन जब कोई कॉलोनी बसती है तो वहां पर इन चीजों को ध्यान में रखा जाता है कि स्कूल कहाँ होगा, पार्क कहाँ होगा, प्लेग्राउंड कहाँ होगा, ये सारी चीजें वहां वो कम्युनिटी के लोग सोचते हैं पहले से और उस तरह से अरेंज करते हैं। आप क्या सोचते हैं कि भारत जैसे देश में, जहां हमारे समाज में इस तरह की विभिन्नताएं हैं और समाज इतना दूर दूर फैला हुआ है, इतने तरह की संस्कृतियां हैं, हर संस्कृति की का अपना एक समाज है। मैं यहाँ मेघालय में बैठा हुआ हूँ और मैं जहाँ जिस डिस्ट्रिक्ट में बैठा हुआ हूँ मेघालय में, ये रिभोई कहलाता है और रिभोई भारत सरकार के लिस्ट में एक बहुत ही कई इंडिकेटर्स पे, डेवलपमेंट इंडिकेटर्स पे एक बहुत ही पिछड़ा हुआ राज्य है। तो लेकिन मेरा अपना अनुभव है कि इस जैसे रिभोई एक जिला है, तो इस जिला में भी कैसे समाज स्कूल के बारे में सोचता है। आपकी क्या राय है कि एक शिक्षक के रूप में आप स्कूल में काम करते हैं, आपकी क्या राय बनती है कि समाज और कैसे स्कूल के बारे में सोचता है और कैसे सोचना चाहिए, ताकि उसको यूं बोले कि वो एक तरह से सपोर्टिव रोल अदा कर सके। जो पूरा मैंडेट है हमारा शिक्षा का, जो पूरा गोल है हमारी शिक्षा का, वो हम बच्चों में प्राप्त कर सके और बच्चों को उस दिशा में ले जा सके। इस पर मैं थोड़ा सा अलग से आपसे स्कूली अनुभव, आपका विद्यालय अनुभव जो है उसके आधार, चूंकि आप एक भारत सरकार के संस्थान में काम करते हैं तो आपको विभिन्न राज्यों में भी काम करने का मौका मिला होगा, तो आप उस अनुभव के आधार पर थोड़ा सा हम लोग को बताएं।
जी सर, एक्चुअली स्कूल जो है वो सोसाइटी से अलग नहीं हो सकता है, वो सोसाइटी का एक पार्ट है और स्कूल का जो सेटअप है कहीं ना कहीं एक इंडिकेटर है कि सोसाइटी में क्या चल रहा है। अगर स्कूल में इंफ्रास्ट्रक्चर की कमी है वो ये भी दिखाता है कि वहाँ के जो लोकेलिटी के जो लोग हैं वो कितने ज्यादा अवेयर है अपने नीड्स के बारे में, अपने बच्चों के नीड्स के बारे में। ये हो सकता है कि कहीं कहीं पर लिटरेसी रेट बहुत कम हो और उसके वजह से पेरेंट्स इस तरह से इन्वॉल्व नहीं हो सके स्कूल में, जितना शायद एक एजुकेटेड पेरेंट स्कूल में आकर बच्चों के टीचर्स के साथ बैठ के बात करके बच्चों के इश्यूज को अच्छे तरह से उठा सके। लेकिन हम लोग ये भी देखते हैं कि विलेज लेवल पर, गांव के लेवल पर संस्थाएं बनी हुई है, मैंडेट्स है कि पंचायती राज के जो इंस्टीट्यूशंस है, ग्राम पंचायत, उसका एक रोल रहेगा स्कूल के सेटअप में, स्कूल के एडमिनिस्ट्रेशन को हेल्प करने के लिए, स्कूल को रिसोर्सेज प्रोवाइड करने के लिए कम्युनिटीज को आगे बढ़ना चाहिए। अगर कोई रिसोर्स है जो सोसाइटी के पास है, वो रिसोर्स स्कूल के बच्चों तक पहुंचे, इसकी जिम्मेदारी भी स्कूल के साथ साथ कम्युनिटी के लीडर्स के लिए बन जाती है। मैं ये भी देखता हूं कि एक सोसाइटी इंडिविजुअल से बनते हैं और इंडिविजुअल्स की अपनी अपनी एबिलिटीज होती है। अगर उन इंडिविजुअल एबिलिटीज और उन इंडिविजुअल्स के एक्सपीरियंसेस को स्कूल के मैनेजमेंट के साथ जोड़ दिया जा सके, उसके एडमिनिस्ट्रेशन के साथ जोड़ दिया जा सके, तो स्कूल को बढ़ाने के लिए, आगे बढ़ाने के लिए और उसके साथ साथ जो बच्चों की इंप्रूवमेंट है उसको हम लोग अचीव कर सकते हैं। एग्जाम्पल के तौर पर हम लोग देख सकते हैं कि कोई क्राफ्टमैन है, शायद उसके पास लिटरेसी के तौर पर वो बहुत पीछे है लेकिन अपने क्राफ्ट में वो बहुत आगे है। आजकल हम लोग देखते हैं आर्ट इंटीग्रेटेड लर्निंग के बहुत सारे जो प्रोजेक्ट्स है स्कूल्स में चलते हैं। सीबीएसई का भी मैंडेट है स्कूल्स में बच्चों को आर्ट के साथ जोड़ने का काम किया जाए। क्राफ्टमैन जो स्कूल के आसपास की कम्युनिटी में है उनको इनवाइट किया जा सके स्कूल के तरफ से, या विलेज के जो एल्डर्स है वो स्कूल के एडमिनिस्ट्रेशन के साथ बात करके ऐसे क्राफ्टमैन को स्कूल में लाए, बच्चों के साथ सेशन करवाए, वर्कशॉप करवाए। तो ये जो रिसोर्स है और जो एक्सपीरियंस है जो कम्युनिटी में ऑलरेडी है वो बच्चों तक इजीली ट्रांसफर हो सकते हैं। बच्चों के इफेक्टिव डोमेन को हम लोग इन्फ्लुएंस कर सकते हैं उनमें क्रिएटिविटी को बढ़ावा दे सकते हैं। साथ साथ हम लोग ये देख सकते हैं कि स्कूल के आसपास जो रिसोर्सेज है, प्राइमरी हेल्थ सेंटर या कोई एक गवर्नमेंट ऑफिस है जहां पर कोई एडमिनिस्ट्रेटर बैठा हुआ है, कोई ऑफिसर बैठा हुआ है, कोई स्कूल में विजिट के लिए आ सकता है, बच्चों के साथ बात कर सकता है, करियर से रिलेटेड उनको बच्चों को कुछ इंस्पिरेशनल जो बातें हैं वो बता सकता है। तो हम लोग देखते हैं कि लाइव एग्जाम्पल, रियल लाइफ के एग्जाम्पल्स, इन आइडल्स को देखकर बच्चे इंस्पायर होते हैं, वो ड्रीम कर सकते हैं कि हम लोग भी इन सब चीजों को अचीव कर सकते हैं, शायद हम भी ऐसे प्रोफेशंस में जा सकते हैं। तो इसके लिए क्या चाहिए, एक होलिस्टिक अप्रोच होना चाहिए। स्कूल के पास एक पूरा फ्रेमवर्क होना चाहिए जिसमें एक प्लानिंग हो और उस प्लानिंग को एग्जीक्यूट किया जा सके कम्युनिटी के जितने भी रिसोर्सेस है उनको मिलाकर। वो शायद किसी इंडिविजुअल के क्राफ्ट को बच्चों तक पहुंचाने का हो सके, कोई एक गवर्नमेंट ऑफिसर है, कोई डॉक्टर है या कोई वेलफेयर ऑफिसर है, उसको स्कूल में इनवाइट किया जाए, वो आए स्कूल में बच्चों के साथ बात करे, बच्चों को गाइड करे। कोई एक ऐसा एनजीओ है जो बच्चों के साथ काम करता है, बच्चों की मेंटल जो हेल्थ को लेकर काम कर रहा है, उसके साथ स्कूल के टीचर्स और एडमिनिस्ट्रेटर को क्लोज कांटेक्ट में रहना चाहिए। बच्चों को कोई भी नीड हो जिसमें उनको सपोर्ट की जरूरत पड़े, ऐसे रिसोर्सेज का काम बहुत ज्यादा इंपॉर्टेंट हो जाता है।
Thank you, Sandeep. I am very happy, and I think our viewers they will be highly benefited out of your deliberation, because you have touched upon many important aspects. The linkage, the organic linkage between school and society, and how this society, even these days, we focus more on the vocational education, for example, and how these vocational things are lying in the society, nearby community, and how our students in the schools and teachers in the schools, they can capitalize on those skills in the nearby community. A very important point you have touched upon. Thank you very much. If time permits, I will come back to you again. Is Mr. Aaron connected?
No, sir. Actually, his internet connection is no more working.
Okay, no problem. No problem.
So we should go to
Yes.
Please.
Now again, I will come to Dr. Mathli and her expertise in the clinical psychology, I believe so. But this time, I would like to hear from her the specific role of the family, and especially on one component. I mean, it's my personal experience also as a teacher and teacher educator throughout my life. I have seen that. Irrespective of the rural parents or the urban parents, educated or uneducated parents, there is, right from the birth, there's a lot of expectation, aspiration on the part of parents from their children. They want that, okay, they should become a doctor or engineer or an IAS officer and all those things. And because children in the family, they keep on listening these things from their parents, and parents are worried about these things, discussing all these things in the family all the time. I think there is some indirect pressure on the young mind. I think, and that even harms a lot. I have seen people dying in IIT. Children are dying in IIT, suiciding in IITs and medical colleges, etc. How do or those who could not? Even in my family, I have seen those who could not get a seat in UPSC or medical. Still they are suffering. They are suffering a lot. I mean, the personality is distorted totally. So how do you look at, and how do you find the way to come out of this?
Yeah, thank you for this very important question. The first is about, we all need to understand that every child has some quality. We feel that sometimes we feel this child has some disability, so maybe, he will not be able to achieve anything in life. That's not true. We consider every child as having some special skill. And we as parents, we need to identify that first. We cannot impose our own wishes and desires on our children. So many a times what we do is we live our life through our children. So we need to understand that they are separate individuals, they have a separate identity, and their life is definitely not our life, and they have to live their life in their own terms. So this is what the parents do not understand, and they fuse their own needs with their children's needs. That is first thing that we should not do, and this ought not to do. So certain do's and don'ts there should be in parenting style. So if we do that, then what happens is that the child becomes very guilty. The child feels very guilty if he or she cannot meet up to the parent's expectation, and that creates a rift, and that leads to sadness and depression as well as suicide, as you rightly remarked. Many times it is not only the parents, the teachers also impose their own needs and expectations of the child, and the children who are brilliant. I mean to say, academically they are brilliant. But what happens if you give a lot of pressure on these children who may be academically they are brilliant, but emotionally they may not be able to cope up with that stress. So there is a concept of general intelligence, and there is a concept of emotional intelligence as well as social intelligence. So we give a lot of importance to physical intelligence and general intelligence, how to think rationally, what to do in life, how to achieve in life and be somebody, great, or have a status and money, fame, name. But we do not give importance to emotional component of life. So when that emotional component is not developed in a child, then definitely coping becomes difficult for those individuals, and stress becomes magnified. A little bit of stress also the child cannot take. If the parent says that I want you to become first, the children who knows that they cannot become first in every class, maybe, they will say, no, I will not become first. And maybe I will do my best, but I don't think so I can get the first rank. So please bear with me. But another child may react to that in such a manner that, I have to get the first rank. If I don't get the first rank, then maybe my parents will reject me. And that might be magnified in that child's mind because the emotional quotient is not well developed. So these are the differences in the children's way of thinking, perceiving a particular stress. And that is how we need to develop our emotional intelligence. So let me just give you what are the emotional wellness questionnaire that we have to ask our children. Are our children able to express their feelings, their emotions? Can they feel comfortable to express what they're worried about? Are they able to manage their own emotions like guilt, anger, sadness, worry? Are they able to manage them well? Are they able to set priorities for themselves? Can they say no to somebody, even to the teachers and to the parents? Are they able to decide with a minimum level of stress? Are they secure when interacting with an angry person? If a person is very angry, if the person is the father is supposedly a person who is very angry in a family, it's not gender specific. I'm very gender neutral, but I'm just giving a template of a father. Will the child bear the father's anger in a very appropriate manner? Does this child laugh every day? Can the child empathize with people when they are in sorrow or when they are angry or when they are worried? Can empathy is there or not in a child? So if these things are lacking, then we develop a kind of a strategy in life where we are always on the edge. We do not know what to do. We are always confused because we do not know. We cannot identify our emotions. We do not know how we are feeling. So when we do not know how we are feeling, how are we going to act? So the difference between IQ and EQ is very important, and we always have to train our heart while we train our brain. So that is what we have to learn as individuals. So there is an instinctual drive in each one of us. We want certain things impulsively in life. No, we want something go-getter types, but we don't have the intelligence to do so. Now, many times we want to become engineers, we want to become doctors, and so on and so forth. But we may not have the capacity to do mathematical abilities are lacking, or the proficiency in physics is lacking. So then we definitely will not be able to take the science stream. Then we have to understand that we may not be okay here. We may be very good in something else. Then the concept of vocational intelligence or vocational skills training comes in. So emotions always drives people, and people will always drive performance. So that is what we need to understand. So Daniel Goleman has given the concept of emotional intelligence, how we can handle. So here the concept of when you said about suicide and people not being able to understand what they want to do in life and what they can do in life, there's a huge gap between what we can do and what we are capable of to do and what we want to do. If there's a huge gap between our abilities and our desires, then the frustration will definitely be more, and the gap will be too much to bear, and we may not be able to bridge that gap. And if we do not bridge that gap, we may be frustrated, we may be angry with ourselves, and that anger may turn inward and we commit suicide. So
Dr. Maithili,
emotions, yes.
Dr. Maithili, I request you to please conclude. We have hardly 2.5 minutes for you.
Yes, yes.
Please.
So what is important for us to understand is how to be aware of ourselves, how to regulate our emotions, how to be motivated, how to be empathetic, and have emotional intelligence to have effective relationships in life. You know, these are the different slides where we have to be resilient and we have to practice self-regulation. So maybe self-regulation, motivating ourselves, and practicing empathy are the skills where every child needs to develop to create effective relationship and take the hurt away and take the pain away, and do not feel that you are a failure, do not feel that you are not worth it, and you put pressure on yourself, you keep losing your job, you want more in life, and you keep getting bored in life, and that will really result in presenting a problem, and we may definitely not be able to achieve.
Thank you. Thank
you so much.
Thank you, Dr. Maithili. Thank you, Dr. Maithili. Yeah, we cannot change our heredity, but we can focus more on the nurturing part, and that matters a lot. And for that matter, we need to learn these things, and we need to apply these things, whether we are parents or society members or the schools. So at the end now, what I find is it was wonderful deliberation from the panelists here, and we have seen that no, there is a triangular synergy relationship between the school, family, and the community or the society. And of course, this triangular relationship is interdependent and very organic in nature, and they are very, very essential to achieve a common goal, a common mandate, which is laid down generally by the country, by any country for its citizen, or by any institution for its intake. So right, I think what we have seen is, and in a word, that the parents, they can develop many things, because from there the root begins, and I think that goes throughout the life. That support and that training goes throughout the life in the individual's life, and then it is the society which has to decide how to create a facility and how to create an environment, how to give the opportunity.
Sir, please, thank you. I think we should thanks to all our panelists.
And society members, and then how to collaborate with the school to achieve all those targeted goals. So with this, I thank you all my esteemed panelists, and I thank you, Rahulji, to you also for giving us this platform.
Thank you very much, Roy sir, and thank you, Dr. Maithili. Thank you, Sandeep ji, and thank you, Aaron sir, जिन्होंने किसी कारणवश फिर नहीं हमारे साथ जुड़ सके. But anyways, बहुत ज्यादा fruitful session था. Thank you very much आप सबके टाइम के लिए. आप हमारे साथ जुड़े, आपने हमारा ये सेशन लिया. Thank you very much. हमारा ये मनोदर्पण परिचर्चा का सेशन यही समाप्त होता है. आप हमारी और आने वाली प्रेजेंटेशंस के लिए जुड़े रहिए, देखते रहिए PM eVidya चैनल और NCERT का ऑफिशियल YouTube चैनल. नमस्कार.